Coming up on the program next are some of the smartest leaders in the healthcare space who are at the forefront of the fight against COVID-19. I'll give you a sneak peek. Dr. Patrice Harris of the American Medical Association, Nancy Lamont, who I just talked about, of AARP, and Congressman Fred Upton, the former chair of the House Energy and Commerce Committee, among a lot of other superstars. But first, it's time to hear from our underwriter, the Better Medicare Alliance.
I'm Marilyn Serafini. I'm the Health Project Director at the Bipartisan Policy Center. I'm here with Congresswoman Allyson Schwartz, who is the president of the Better Medicare Alliance. So we're facing a difficult situation in our country at this time, and it's particularly a difficult economic situation and a health situation for people over the age of 65, many of whom are living on fixed incomes. Financial concerns, of course, are now exacerbated by COVID-19 pandemic. People are losing jobs, they're being furloughed, and everybody's really watching their pennies. Let's spend a little bit of time talking about Medicare Advantage. We know that more than a third of Medicare beneficiaries choose to get their healthcare coverage through Medicare Advantage. So, Congresswoman, tell us about the work you do and how Medicare Advantage plans are responding to COVID-19.
Okay, well, I'm pleased to be able to do this interview. But first, let me tell you just very briefly about Better Medicare Alliance. We are a national coalition that advocates for Medicare Advantage. So we are a coalition of actually 143 organizations. They are plans, health plans, and provider groups, health systems, and primary care physician groups, as well as professional associations from the American Nurses Association to the Telemedicine Association, which I'm sure we'll talk about telehealth, but as well as almost 500,000 beneficiary advocates who we work with to advocate for themselves and the healthcare that they value. So been around for about 5 years, and we do both research and policy commentary and advocacy to make sure that there is a strong Medicare Advantage option, which has been growing. Many Medicare beneficiaries get to choose how they get their benefits, either Medicare Advantage or traditional fee-for-service Medicare. And as you point out, it's about 36% of beneficiaries are in Medicare Advantage. They've chosen that, and it's about over 24 million Americans and growing. So the system is one that is an integrated system. It is one that you choose the network of providers who work together to provide comprehensive coverage, all the coverage they're required to cover all the Medicare benefits, but they're also allowed, if they can save money by helping keep people healthy or keep out of the hospital or the ER, they are able to use some of those savings to invest in additional benefits that are not covered under traditional Medicare. And what that really means for beneficiaries, particularly in the time you're talking about, which is right now in the middle of a national health emergency, a pandemic that is affecting every one of our lives. You and me sitting at home, doing our work from home if we're able to, you pointed out that many families are seeing furloughs in their families. Many people, and particularly, this is hard for all of us, but particularly for seniors, and I'm over 65, so I'm one of them, looking out for ourselves by staying home, by being very careful about social distancing. And actually that means also somehow staying a little further away than we'd like to from our loved ones. I have 2 sons, 2 daughter-in-laws, 2 granddaughters, one is 7, and we get to stay 7 feet apart, but I haven't been able to give her a hug or, for a couple of months now, and a 3-month-old who I'd love to hold, but I'm not supposed to. So these are tough times for us as grandparents, as parents, and as also for seniors. They have many chronic conditions, so frequently. So even in the midst of the pandemic, where we're trying to keep ourselves safe from COVID-19 and do the proper things, we need to be in touch with our healthcare providers. And that's where I think Medicare Advantage has really been able to step up in this crisis, as so many of the, for everyone is trying to do that. You see really great, enormous disruption in our healthcare system. So we see New York or New Orleans or Michigan, we are following all of that. Washington State, of course, where we saw first cases. But what we also need to see is how do you actually get care to the people who need care, just need routine care. And Medicare Advantage plans, first of all, stepped up and said they will have no copays. Many people do not pay zero premiums. Half of the people in Medicare Advantage don't pay any premiums, which is great for their Medicare coverage, Medicare Advantage coverage, and for Part D. But also, they now don't have to worry about copays for testing. Most plans, or many of the plans, have also said no copays for treatments. That's a relief, not to worry about those additional expenses. But where Medicare Advantage actually, I think, really was able to step up was to reach out to their patients, provider groups, health groups, many of them that are part of our alliance, talked about even when they had to shut down their offices so their patients could be safe and their staff could be safe. They knew who their patients were. They had care teams who could reach out to them, particularly for those who were at high risk, had chronic conditions, who needed to be in touch with a practitioner. One who said they were calling every one of our patients, going down the list from the most severely challenged with chronic conditions to everyone else. And of course, they moved to telehealth visits, which has been something we've seen across the systems, but we really had already Medicare Advantage plans were allowed to provide telehealth visits, and about 40% of them already were doing it. So they had to scale up, but they had systems in place to do it. So just can touch on a few things that we know we've seen them do.
So let's talk a little bit more about telehealth. You mentioned that even if someone does not have COVID-19, seniors have a lot of medical needs. And if you need to see the doctor, right now is not the time to be walking into an office or to walk into the hospital if you can help it. So talk a little bit more about what the plans and providers have been doing in the way of telehealth. What does that look like, and how have the Medicare Advantage plans stepped this up?
Yeah, happy to. And so when some of these stories about what's been going on in Medicare Advantage, we are putting out today a spotlight on innovation on Medicare Advantage's response to the COVID crisis. So, and when you go on our website at Medicare Alliance and find that spotlight, if you are watching today during this virtual event, we're going to make that available. You'll probably see it on the screen somewhere. So you can check it out. So I think we have about 15 of our providers and plans and community partners who talk about how they've stepped up and some of the really interesting work they're doing. Just to talk about telehealth is, one of the things is to, first of all, have a system as a provider that enables you to do what we're doing, and to do that with patients in a secure way. So of course there are regulations about confidentiality and security, and you don't want more than one patient listening in at one time. You want to be able to do this in a really secure way. Some of them really had systems already, plans already had some contractors who were doing telehealth. And others who were able then to scale it up. So we have one provider who said, must have been like 2 weeks into the stay-at-home rules, saying they were delivering iPads to patients who they really felt like needing to see them, not just talk to them on the phone, was extremely important. And so unfortunately, just last Friday, CMS said that would count as a medical expense, which is fantastic. And CMS, the federal government, did also step up and say that televisits themselves would count as a clinical encounter, which is really great too. So that all helps. But even before all that happened, a lot of Medicare Advantage plans were setting up systems, having appointments basically by telehealth. And it is a great way to make sure that people with underlying conditions, whether it's cardiac conditions or COPD, or kidney care that they needed, they have chronic kidney disease, or hypertension, or actually it turns out all of the comorbidities that make you more at risk should you get COVID, they were able to reach out, not do everything, but know then when they could actually say, okay, you are someone who needs to be seen, here's where you go. So I think that was important for the clinical care, but also important to reassure seniors in particular, or those who are disabled on Medicare, that they knew who to call, when there's a problem.
So in the last minute that we have, what should and do you expect Congress may do moving forward? They've already taken a lot of action to send out a lot of money to both patients and to hospitals and to try to ease the financial situation. But and to ease these telehealth barriers. What else should or do you think Congress may do moving forward?
Well, first of all, we have seen Congress step up and really take some extraordinary action in a bipartisan way, which is important, particularly to attend to the economic crisis that's going on in so many families and businesses across the country. And we've seen CMS step up and waive certain rules. Thank you both Congress and CMS for doing that. But we need going forward to continue to see the kind of bipartisan support that Medicare Advantage has been able to garner over the many years. We've seen 75% of members of Congress signed on to a letter in support of Medicare Advantage just this year. That was extraordinary, particularly given the number of new members who are in Congress. So thank you, Congress. I just ask you to look out for Medicare Advantage. It has very different rules than the fee-for-service system. And we look forward to your continued support to make sure that those 24 million beneficiaries and the ones signing up for 2021 will have access to the quality integrated care and Medicare Advantage.
Okay, Congresswoman Allyson Schwartz, Better Medicare Alliance, thank you very much.
Thank you, Congressman Schwartz and Marilyn.